Hi everyone, I'm Dr. Tan Iping, consultant obstetrician and gynecologist, and today I am going to talk about fertility. I'm going to talk about fertility because I see a lot of PCOS women wasting years after years after years of their precious youth because they're supposed to get pregnant, but they wasted so many years because they didn't do the right thing, and as a result they find it very difficult to get pregnant eventually, because by the time they realize they need to do something, it may be a bit too late already. Number one, you need to understand that PCOS, they have problem with ovulation, so very difficult to ovulate. Can say more than 90% of PCOS do not ovulate every month. They either ovulate on and off, maybe 1 year, 2 times, 3 times, or they ovulate no ovulation at all the whole year. Can be 1 year no ovulation, can be 3 years no ovulation, depends on how extreme the case is. Why more difficult? Number one, PCOS, the older you are, the more difficult to ovulate. If you are 17, 21, most likely you still ovulate on and off. Then if you see doctor, I give you medicine, you definitely ovulate. If you are 31, maybe you're not ovulating anymore on your own. Then if you see doctor also, maybe cannot ovulate. So you see, the older you go, the more difficult to ovulate as a PCOS. Even you come and see doctor, the older you are, the more difficult the medicine will work. I have this lady also, I remember, she has PCOS many years ago. She saw me. Then I give her simple Clomid, I give her. And then she ovulate, then she got pregnant, happy already pregnant, and then give birth already. But after give birth, she didn't do anything. She kept on waiting, and then many years passed already, 3-4 years, not pregnant. She come back to me. So she thought very easy, come back and see Dr. Tan, get Clomid. And this time she take Clomid, it didn't work. She never ovulate anymore with Clomid. See, so I say, the older you are, the more difficult for the medicine to work even. So it's always better to come and see us earlier. So in PCOS, the older you are, the more difficult to ovulate. Whether on your own or whether with treatment, it's more and more difficult to ovulate. Number two with PCOS is, the fatter you are or the thinner you are, the more difficult to ovulate. But for women who are thinking about fertility, I don't want you to waste too much time losing your weight or putting on weight, because it's not easy. I told you, fertility, time flies. Suddenly it's 1 year already. Suddenly it's 2 years already. I normally feel that for PCOS, weight is important, but we shouldn't wait for the weight to go down. We cannot wait for the weight to go down. We need to treat you first. We need to treat you, we need to get you pregnant. Your weight can come down slowly, but we still need to get you pregnant. We cannot wait for your weight because it's easier said than done. Okay? That's why I always say that polycystic ovarian syndrome is a solvable problem. There are many medications out there. We have Clomid, we have Femera, we have glucophage, we have injectables, we have ovarian drilling, but there are many. So normally what happens is that we always start with one. Then we see whether you ovulate or not. If you don't ovulate, then we go to the second one. Then we see whether you ovulate or not. If you don't ovulate, then we go to the third one. Then we see whether you ovulate or not. So don't keep changing doctor. You know when you keep changing doctor, you go and see a new doctor again, start from the first one. Again start from Clomid. You see, so you waste your time again. That's all for today. Any more questions, please put in my comment section. See you. Bye.